मैम इस तरफ
लाइट ऑफ करो, लाइट ऑफ,
लाइट बंद करो।
एक मिनट प्लीज।
Brigadier Ali of the Kumaon Regiment has been decorated with the Sena Medal for exemplary services rendered during the Kargil War. He holds the honor of having received Chief of Army Staff Commendation Card and Commander-in-Chief Andaman and Nicobar Commendation Card. He served a vital role as a member of the Indo-US Steering Committee, which was constituted to promote bilateral military ties. He has also been closely associated with several academic institutions of repute. Ladies and gentlemen, I have the privilege to invite our guest of honor, Brigadier Sayyid Ahmad Ali, to please address the audience and give his blessings. Brigadier Sayyid Ahmad Ali, Pro Vice Chancellor, Aligarh Muslim University.
Our chief guest, Mr. P.K. Pradhan, Vice Chancellor General and Mrs. Zamiruddin Shah, Dean Medical Faculty, Professor M.H. Baig, Principal Medical College, Professor Ashraf Malik,
पीछे आ रहा है यार वरुण।
the Joint Organizing Secretary, Mr. Sherwani, members of the faculty, dear students of this college, and our distinguished guests, particularly respected Padam Shri Professor Mehdi Hassan and Padam Shri Dr. Ashok Seth. Today is a red letter day in the history of the medical college. 50 years is long enough time to grow of age. And we can truly say that the college today, or its golden jubilee, or day rather, has come of age. Being my 6th day of arrival in Aligarh, I have only had the fortune of hearing about the college. But whatever I have heard conveys a lot. The college is responsible for bringing smiles to millions and lakhs of people all these 50 years of its existence. You have touched lives as nobody else would have touched in Aligarh. You have indeed brought pleasure when pain was ruling that body. You have indeed brought succor to the ailing thousands who have visited you all these years. I am sure nothing could have been a greater tribute to the soul of Professor Hadi Hassan, but the way you have gone about treating the people, despite the handicaps, despite the low amount of grants that you had, the way you have never said no to anybody who ever came to you for treatment, speaks volumes of your dedication, of your competence, and your ability to bring cheers to their faces. I must congratulate each one of you. General, we have besides me our Vice Chancellor and Chief Guest to address you. I do not wish to prolong your wait for the Nazar evening as well, but I would simply end up by exhorting my young colleagues who are sitting in that corner that here you just witnessed two of your distinguished alumni who the nation has conferred with such a high award of honor. I would request you, please emulate them, please follow their footsteps, and I can assure you similar honor will become you also. I wish you all the best, and I wish the medical college the best of everything in the years to come. May the college grow to the loftier heights and higher pinnacles of distinction and glory. Thank you.
For those warm words of encouragement, for those thought-provoking words. We're indeed blessed to have you with us today. A truly memorable souvenir has been prepared for the grand occasion of the Golden Jubilee of Jawaharlal Nehru Medical College. It has been prepared with loving care and great attention to detail. It is sure to usher in waves of nostalgia and refresh many a sepia-tinted memory. It is my privilege to request our distinguished Chief Guest, Mr. P.K. Pradhan, Honorable Secretary, Health and Family Welfare, Government of India, to kindly release the souvenir. I request Dr. Shahid Siddiqui and Dr. Bilal Hussain to please do the honors. Dr. Shahid Siddiqui and Dr. Bilal Hussain.
भाई यार प्लीज आपने बोला भी है कि यार
हाँ नहीं सबके हाथ में है नहीं जो भी है दिखाते हुए यस पीछे आ जाओ पीछे आओ
1977 batch. He was previously Special Secretary and Mission Director, National Rural Health Mission in the Department of Health and Family Welfare. His illustrious career, spanning more than 34 years, has been exemplified by rare excellence and an abiding concern for the plight of the common man. Mr. Pradhan has handled various important portfolios in the urban sector, both in the state government as well as in the government of India. He has also been spearheading the iconic National Rural Health Mission since the last 2 years. Who can tell us better than Mr. P.K. Pradhan, Secretary Health and Family Welfare, the roadmap for the future of healthcare in India? I request our Chief Guest, Mr. Pradhan, to kindly illuminate us with his extensive experience in healthcare in India. Mr. P.K. Pradhan, Secretary Health and Family Welfare, Ministry Health and Family Welfare, Government of India.
Vice Chancellor, Dr. Malik, Dean Faculty of Medicine, Professor Beg, Joint Organizing Secretary of the College, Dr. Mehendi Ashan, Dr. Ashok Desai, all the distinguished faculty, students, and the distinguished ladies and gentlemen. I am really honored to be here on this momentous occasion. I wish first to congratulate all the distinguished faculty, alumni of this medical college, which is integrated part of the Aligarh Muslim University, one of the most prestigious learning of the country, established long back in 1978. The Aligarh Muslim University has been a building block of our nation and played a very sterling role in promoting secular ideals which have inspired this nation. The Jawaharlal Nehru Medical College is also an embodiment of the same spirit as has served the country for the last 5 decades in providing medical professionals and also quality health care to the entire population. Yesterday we had 2 of the key ministers, both education and health minister here. When we talk of inclusive growth, we must ensure that it is not possible unless education is become a reality for everyone. Health is not merely an absence of disease or infirmity. It is a complete physical, mental and social being, and education is key to better health outcomes.
इमरजेंसी निकाल ली
The evidence also shows that education is key to improve health parameters,
इमरजेंसी अंदर जेब में
and
पड़ी
more educated have lower mortality from the acute and chronic diseases. When we talk the chronic diseases, we are having an increasing prevalence of non-communicable diseases, whether it is diabetes, cardiovascular or cancer. In fact, it is said that in another 15 years, India is going to capital of all these non-communicable diseases. However, we need to plan right from now, and for the last 2 years, we have started a national program for cancer, CVD, diabetes and stroke, under which we want to do preventive screening of all population above 30 years of age and all pregnant women. We started this in 100 districts of the country and already covered more than 1.10 crore population, and the findings are quite heavily. In many of the rural pockets, tribal pockets, earlier we used to know that probably you talk of diabetes, it is mostly southern states like Kerala which are having more prevalence diabetic and hypertension. But the results of this survey that has been now indicated, many of the tribal pockets, many of the rural areas of states like Madhya Pradesh, Chhattisgarh, Odisha are suffering from very high diabetes and hypertension. In fact, some of the places it is as high as 28%. That really causes us to think and plan for future. We want to do more preventive health measures and health promotion.
मेरा डायरेक्ट चल रहा है नेट से.
We want to create a database of all the population so that those in the borderline cases can be counseled. But that takes us to the next stage as to what to do with those identified with hypertension or diabetes or even cancer. We need to create more secondary and tertiary care facilities to ensure the timely referral and proper treatment. In this context, the medical colleges to play a very key role. Not only they have to mentor the district hospital, but they also provide the tertiary care services. In fact, under the KMSSY, the Aligarh Municipal Government Medical College has been identified to develop super specialty blocks. We propose to create more and more super specialty facilities, not only for provide tertiary care, but also to provide more super specialty manpower. While talking NCD, India is a country which is faced with the triple burden of communicable diseases like TB, malaria, dengue, diarrheal disease, the non-communicable diseases, and also the emerging and re-emerging infections like HIV/AIDS, H1N1, influenza, Congo criminal fever, and all this. In addition, we have a very huge burden of maternal child mortality. We need to tackle all these three burdens with a combination of preventive, promotive, curative and rehabilitation measures. In this context, public health measures are expected to prevent epidemic and spread of diseases, protect against environmental hazards, prevent injuries, promote and encourage healthy behavior, respond to disaster and ensure quality and accessibility of basic healthcare services for general population. Somehow we have been neglecting the public health in the country. We don't have strong public health cadres except for few states like Tamil Nadu and Maharashtra. I think in a university which has a medical college like Aligarh Muslim University or Banaras Hindu University, which are very unique in having a medical college located in a university, we need to think of how to develop a public health facility. Because now we do lot of master in public health, but no degree in public health. To bring mother to the institution, the JSSK which entitled a pregnant mother and 6 neonates for free treatment. Community oversight through the Rogya Kalyan Samitis and a new edition of accredited social health activist that is called ASHA. That was some of the key areas of National Rural Health Mission. We have augmented large number of district hospitals, community health center, primary health center, sub-centers. And considering that we need to support the states further, it has been further continued in 12th plan with also additional approach towards the addressing the health concern of the urban poor, because so far we have considered rural areas also, but urban health has been neglected. So it is proposed to launch a urban health mission. And now in the 12th plan, the goal is towards the accessing universal health coverage. When you talk of universal health coverage, this has been an aspiration long time back, but somehow with the limited financing, I think the Vice Chancellor here knows more about the implication of inadequate financing than anybody else. The inadequate financing by the states and also government in general was one of the serious bottlenecks in moving towards universal health coverage. We have been using almost less than 1% GDP in the health sector, in public health of both state government and government taken together is less than 1% GDP towards the public health funding, which it is proposed to take to 2.5%. The approach is to further strengthen the public sector, supplement with the private sector, provide a combination network of primary, second. We have, over the last 3 years, tried to rationalize the medical norms to encourage more and more medical colleges. Over the last 4 years, we have increased the medical undergraduate seats by almost 12,000 and the postgraduate seats by 9,000 by rationalizing norms and creation more facilities. We want to take it at least up to 65 to 70,000. The plan in 12th plan is to assist the deficient states, because not only our doctors' availability and doctor specialty is a problem in the country, but also the existing medical colleges are very skewed. The southern states account for more than 44% of medical colleges, medical seats and also doctors. The western states account for 22%, whereas the northern, central all account for remaining ones. So on the one hand, the shortage of both doctors, nurses, paramedics. On the other hand, they are also distribution skewed. We want to support all the state governments deficient in medical colleges to set up more medical colleges, expand the seats in the existing medical colleges, create more super specialty to have more specialist doctors, and improve the quality of care. We would like the hospital and the medical college in the public sector to be equal and provide equal level of services and quality care as that of any private hospital. That will require a lot of resources, but hopefully the 12th plan is going to augment the entire budget by almost 2.5 to 3 times. So obviously